lipoplasty option as opposed to a tummy tuck. Right, okay, well, an abdominoplasty and a tummy tuck are the same thing. So the words are just, I think abdominoplasty is just a fancy word for tummy tuck. So they're the same thing. So yeah, there's not a difference between the two. But this is a relatively difficult situation when someone hasn't got a huge amount of spare skin, or at least when someone has got quite a good abdomen, but feels that they've got a bit of laxity, and this patient's obviously got laxity in their anterior abdominal wall. So if you've had 9 full-term births, I'm sure there will be some spare skin, but maybe not enough that might require a tummy tuck. So it's always difficult with this on without seeing patient and examining the patient, because often there is some skin laxity, so it would be possible to do a tummy tuck. But if you have no skin laxity and no skin to remove, then you're looking at repair of your anterior abdominal wall muscles. Your anterior abdominal wall muscles have been stretched by the pregnancies. They also get stretched with weight loss, so the whole abdominal wall is lax, so your intra-abdominal contents make you look pregnant, or make you look like you have a sort of barrel-shaped abdomen, because the abdominal wall is not holding it all in tight. So you need to have the abdominal wall tightened. Now that is an integral part of a tummy tuck. So we do that routinely when we do a tummy tuck, but it's a bit more difficult, well, a lot more difficult when you haven't got the skin to remove for a tummy tuck, because you have to access the anterior abdominal wall, and you have to access it all the way up to the rib cage. So if you are having a tummy tuck, that is all open and it is all easy to access. But if you're not having a tummy tuck, it's more difficult. The easiest way to do it is by doing a midline excision straight down the middle of your abdomen, to access those muscles and repair those muscles. So that's the easiest way to do it, and probably the best way to do it if you're not having a tummy tuck. But you might not like that because it gives a midline scar, which is very obvious if you are wearing anything that exposes your abdomen. So it would be possible to do it laparoscopically. I don't do it laparoscopically. I don't know if anyone does, but that might be an option because the scars will be smaller. But probably the last option would be to see someone to see if you have enough skin laxity for a tummy tuck. It's always difficult when you don't have a huge amount of skin laxity, because that could mean the scar can drift a bit high, because it's often closed tight if you haven't got a huge amount of skin laxity. But there might be enough laxity to do a tummy tuck, a full tummy tuck. And if that's the case, then the muscles will be repaired during that. But if you truly haven't got enough skin excess, I would say a midline incision would probably be the best way to go, but you might not fancy that. So the last option is laparoscopic diverification repair, if you can find someone who does it. I'm not saying there isn't anyone, it's just I don't know of anyone. But yeah. So bottom line is abdominoplasty and tummy tuck are the same thing. Can you remove my cross-shaped tattoo? It will take more than one treatment, and if so, or will it take more than one treatment, and if so, why? So this patient's allowed me to show the photo, so I'm showing it now on YouTube and on Facebook, but not on the Gram or the Talk. So if you want to see it, that's it. You see it? That's it there. That's the Gram and the Talk. Can you see it? That's it there. See it? Right. A bit lo-fi, I know, but I don't know how to share photos on this. Actually, I might be able to share a photo on Instagram. Think about it. Let's request to join. I think there is a way to share a photo in there. Let's turn the camera off. Oh, should I research? It's hard to research this stuff when you're not actually on the, because you have to do it during a live. Is there a way to? Okay. Can I do it on TikTok? Anyway, I'm sure there is a way of doing it because I've actually done it. Okay. No, that's not it. Okay, that's not could be all day. Yep. Okay, that's not it, is it? Okay. Anyway. Okay, you've seen it anyway. It's a cross-shaped tattoo on the forearm. So this is a cross-shaped tattoo on the forearm. So the thing about this is that the linear aspect of it, the main bit down the middle, will be able to remove. I think there's some V's on it, but I think you'll be able to. I think we'll be able to remove that in one go. The problem is the horizontal portion of it with the dotted arrows. That's going to be a problem because they are not going to come out when you take out an ellipse in a longitudinal direction down the force of the volar aspect of the forearm, so they will remain, and so you'll have a scar with tattoo coming off on either side. So the question is what you do about that. Now you might say, you might not say, I don't know, but it might be not unreasonable to think that you can just cut it out that way and give an X-shaped scar. I wouldn't do that for lots of reasons, not least an X-shaped scar will look bad, it will heal bad because when there's two scars meeting, it's just not good at all. So I wouldn't do an X-shaped scar. I would aim to do a serial excision while keeping one scar, just keeping the straight line scar down the middle. So if you're keeping the straight line scar down the middle, you're going to have to take it out in a side-to-side direction. So you're going to have to do a few serial excisions because if you look at the width of the dotted arrows, they're almost the whole width of the forearm. So I think that is going to take 3, 4, I can't remember what I said now, a few goes. It's hard to predict. I usually over predict because I don't want to disappoint people, but it's going to take maybe 4 or 5 goes to just keep on pinching a little bit in that side to side direction, which is annoying because the big lot bit down the middle will come out in one go. So thank you for allowing me to show the photo. And that is a situation with that. You would take it in an up-down direction, but the width of the cross would have to be slowly narrowed in an up-down direction as well. So you only end up at the end of the day with one scar, but it might be a bit stretched in the middle because you're going tight. In the middle. So yeah, I hope I've given that justice. Always nice to show a photo, mix it up a bit. I'll try and work out how to do that on the gram and the talk. What type of doctor do I look for? And how much does surgery cost to correct piercing scars? I have multiple belly piercing scars, and so also lap scar from surgery. Multiple belly piercing scars. Is that dermal anchors, presumably? So, I mean, what sort of doctor? I mean, plastic surgeon would do that. I don't know if you know anyone. Is there anyone around here? If you know anyone, anyway. Yeah. How much does surgery cost to correct piercing scars? I don't know. Send us a photo. We'll send you a quote. It's going to be probably $998, I guess. I don't know. Something like that, ballpark. But do send us a photo and we'll give you a proper quote and things because I don't really deal with the prices. But yeah, always difficult correcting scars because like you got to think you're still going to have a scar, and in fact your scar will be a little bit bigger than the original scar, but the aim is to sort of make it not kind of dented in because a piercing is obviously a hole often, so you make it not be a hole, but sometimes it is a little bit dented in. So the problem with correcting these things or excising piercing scars is we've got to be careful not to have an unhappy patient. So we've got to try to manage expectations before doing it, because you're not getting rid of it. You're making it no longer a hole, and it might be a little bit of a dent. So it might not be completely flat because it's really hard to fight against all that scar tissue. Yeah. Question. Thank you for that. I have got a really small cyst to the right of my right eyebrow, and the skin is so thin that the sac looks like a hard pimple. It's been there a while, and whenever I wash my face, it hurts. Any tips? What should I do? See a doctor. That's your tip. And get it removed if it's a cyst. There's not a lot you can do at home for a cyst. You can burst it. You can stick a needle in it. It might get infected. Stuff might come out. You might think it's disappeared. But if you don't remove the sac wall, it will come back again. And if it's hard, then it might be hard to evacuate the contents. And it could be something else. If it's kind of calcified hard, it could be a calcifying epithelioma of Malherbe, also known as a pilomatrixoma. Kind of doesn't really matter because it's benign, but it could be a different type of cyst. But you can't really remove it at home, at least not permanently. You need to remove the cyst wall. And it's often the way that around the eyebrow, things, the skin is very thin. So that's not unusual. So I guess see your doctor, get it looked at, and then if you want it removed, find someone. Maybe your doctor can recommend a plastic surgeon to remove it or someone to remove it. So I have got a really small cyst to the right of my right. Okay, just done that one. Okay, that twice. Okay. Hello, I'm having this lipoma on my forehead, so I had a question that if I burn fat off my body and lose weight, is it possible to be removed? Yes, it is possible to be removed even if you don't burn fat and lose weight. Is that what you're saying? Are you saying, is it possible to be removed? Or are you saying, will it get removed if I burn fat and lose weight? So, so if you lose weight, yes, you can have it removed, but you can have it removed even if you don't lose weight, as long as it's kind of palpable or visible. And I kind of would imagine you wouldn't get it removed if it wasn't palpable or visible. So, but are you saying if you lose weight, will it disappear? Which I think might be the question here. And the answer is no. Sometimes when people lose weight, they're more prominent because they lose subcutaneous fat, but they don't lose the fat of the lipoma. So they can become more prominent. But no, that is not a way to treat them by trying to lose weight. They are kind of benign tumours. So yeah, that won't fix it. Moles keep popping up and I don't know what it is. Sorry, put it on there. Moles keep popping up and I don't know what it is. Yeah, I mean, first of all, we are talking about skin moles here because we often have to clarify that a bit with Google. It is skin moles that we deal with. We don't deal with like garden moles. So we'll just take it as read that this patient is asking about skin moles. And they do as you get older, when you get pregnant, sometimes in the sun, you can develop more moles and your moles become more prominent. That's not unusual. So don't worry about it. I mean, if you're worried about anything, if anything's changing, size, shape, bleeding, itching, anything like that, then go and see your doctor and get it checked out. But in itself, don't worry about it. You know, you can get new moles and you can get changes in your current moles. It doesn't necessarily mean it's gone bad, but it does mean if you do get some changes, you should get it checked out and get it looked at. I've got a cyst on my neck that grew under a mole. I can squeeze little bits of white stuff out in the morning, but it's scary because I don't want to get infected and I don't know if surgery is a good idea due to the location. I also suspect ingrown hair accompanying it. Yes. Well, it's hard because sometimes you can, if it is an ingrown hair and a bit of infection, that will settle down on its own. So you don't really want to get a scar if it's going to be something like that. So if you think it's settling down, or if you think you've seen it before and it's settled, you know, and you know how to fix it, I would go with that because, you know, that's the most important thing, really. If you've got an idea, then to do that. But you're absolutely right. If you start messing with it, if you start pushing and pulling it, then it can get infected. So that is the problem. It can get infected. So you don't want to, you know, as a rule, it's best not to meddle. meddling can lead to at least traumatizing it, at least inflaming it, and possibly making it infected. And the problem is, if it is a cyst, then if you don't remove the cyst wall, it can keep coming back. So you kind of have to get rid of the cyst wall, and you can't really do that at home. So you can squeeze stuff out of it, and it might feel better and look better if you squeeze stuff out of it. But if the cyst wall's still there, it will keep on refilling. So really, you need to see a doctor and look at getting the cyst wall removed to cure it. But I understand that's quite a big deal. So especially if there's an ingrowing hair, maybe you'll be able to treat it with topical solutions. So that might be an option. Whoa, that was intense. So that's my questions and answers for today, the 27th of January 2026. So peace and love to you all. If I've missed a question, then 1,000 apologies. I really didn't mean it. So if you do have any questions and you feel left out, then please feel free to message me and I'll ask them next week. Hopefully I'll be a bit more awake, and I will bid you good night, and I will see you next week. Until next time. I'm going to have to start TikTok again just to end it because the thing's crashed, but enough of my TikTok comments. Sorry, this is not my, sorry, I'm going to go. Yeah, okay, thank you. Thank you. Am I back live? Just came back on simply to close it, really. Am I still on this one?